One thing I wish I had learned when dealing with psychiatry and medicine is the schizo classification. Now, I had no exposure to any psychiatric illnesses prior to my medical school education, and all of these schizo classifications kind of get jumbled in my mind. So I decided to put together a list of the different disorders. Now, as you can see, we have schizophrenia. Now, that's going to be a diagnosis. It's going to be a disorder that you can treat. Now, it's going to be based on the timeline. So if we have schizophrenic motions that last less than a month, that's just simply called brief psychotic disorder. Now, these timelines are important because boards and tests like to take this into account. You have a patient that has been acting weird for 2 weeks. What do they have? And they're going to list, do they have schizophreniform? Do they have schizophrenia? Do they have schizoid? What's their diagnosis, doctor? And then you're thinking, well, 2 weeks, that's less than a month. So they just have brief psychotic disorder. However, your patient now has been presenting very strangely in a very characteristic fashion for 5 months. That falls within the 1 to 6 month. That is going to be a schizophreniform. You can't diagnose them with full-blown schizophrenia yet. They are in the diagnosis range of schizophreniform disorder. Greater than 6 months is the traditional schizophrenia. So that's going to be an important realization. Schizophrenia can only be diagnosed if they have the disorder for 6 months or more. Now, if they also have a depression or a bipolar disorder thrown in on top of their schizophrenia, then it's called schizoaffective disorder. And I like to think of that as they're affected by more than one disorder. They have schizophrenia, but they're also affected by bipolar or depression. Now, on a separate note, although the names kind of look the same, schizoid versus schizotypal, now it's kind of a separate category. Now we're going to be dealing with personality disorders. Well, this is more of a diagnosis, more of a condition. This is going to be more of a personality disorder. Now, personality disorders are very inherent, meaning that it's normal to the patient. They're egosyntonic. These are ego-dystonic. These are ego-syntonic, meaning this is who they are. It's their personality. Now, schizoid versus schizotypal. Now, how do we distinguish these two? Schizoid diagnosis is typically the very distant person. They don't have very good friend relationships. They really don't care. They're very distant and very isolated, kind of introverts. They just don't care. They don't care if their dog died. It's just a fact of life. They say things in a very disconnected fashion. How I think of that is Futurama. I love Zoidberg. Zoidberg is kind of a weird little alien that has nobody like him. He's very isolated. He doesn't care. He's Zoidberg. So that's how I think about it. And then schizotypal is going to be you're more whimsical, you're more magical thinking. They believe in horoscopes, and not only believe in horoscopes, but really kind of live the horoscope lifestyle. They kind of Luna Lovejoy from Harry Potter is how I think of schizotypal personality. Kind of spacey, kind of just out there with magical thinkings. Unicorns are real. Not affecting their lifestyle. They're not paranoid. It's just they're whimsical. It's who they are. They believe in this, and that's who they are. So this is kind of the breakdown. Hopefully it helped a little because all of these names do get jumbled.